RJ Vicky, Vicky, KV Mato show ನಡೆಸ್ಕೊಡ್ತೀನಿ 92.7 ಬಿಗ್ ಎಫ್ ಎಂ ಅಲ್ಲಿ. ಸೊ ನಿಮಗೆ ಗೊತ್ತಿರೋ ವಿಚಾರನೆ, ಸದ್ಯಕ್ಕೆ ನನ್ನ ಜೊತೆಲಿ ಡಾಕ್ಟರ್ ಸೂರ್ಯಕಾಂತ್ ಚೌಬೆ ಇದ್ದಾರೆ. ಸೊ ಈಸ್ ಅ ಪ್ರೊಫೆಸರ್ ಅಂಡ್ HOD of Urology, St. John's Medical College and Hospitals. So hi Suryakant sir, how are you doing?
Hi, good evening sir. Doing fine. Thanks for your brief introduction.
Thank you sir, thank you so much. So how are you doing sir? And
doing good. This is a corona time, this is a COVID time, so we are just taking all precautions and looking after our patients. Of course we are going through a lot of stress, but we are happy to treat our patient.
Amazing sir. And firstly I will have to congratulate you personally from Big FM and from my end for serving us during this pandemic.
Thank you so much sir for your appreciation.
Yes sir. So right now we are here to talk about BPH. Well, before that, let us explain what does the prostate mean.
The prostate is an accessory gland of the male reproductive systems, and it increases the bulk of semen. The semen which is for the reproductive function, the main bulk is formed by this prostate gland.
Okay.
And it contains a lot of proteolytic enzymes which keeps this semen in the liquid state needed for fertilization and reproductions. So this is the prostate gland, and it is situated below the bladder.
Okay.
And the main function is to assist in the reproduction.
All right. So doctor, what is the main common disease conditions of this prostate?
It all depends on the age. In the younger age group, we have an infection or inflammation known as prostatitis. Usually it happens in those sexually active persons who has a regular sexual intercourse, and if he is going for abstinence, and also then there may be congestion of the prostate gland leading to prostatitis. Sometimes maybe the urinary tract infection. It is a part of urinary tract infection. If the bacterial infection, non-bacterial infections, if it's a bacterial infection, it is also known as bacterial prostatitis.
Okay.
So it happens in the younger age group. As you grow, then after 50 years of age, a condition on a benign prostatic hyperplasia, which I think you already discussed with that.
Yes.
That is benign growth. So after 45-50 years of age, what happens as a part of aging process? This is the growth of the prostate is a part of aging process, and there are two types of growth. One is a cancerous, one is a non-cancerous.
Okay.
So this non-cancerous part is known as BPH, benign prostatic hyperplasia. Another part is a malignant, which is a cancerous growth. Sometimes this may be involving tuberculosis, which is more prevalent in our country. So it has been seen, but it is not very common problem. The tuberculosis of the prostate is not a common problem, but usually it may encounter in the day-to-day life.
Okay. So basically, a younger age group of people who are having excessive of intercourse. Is that what you just meant?
No. Actually, excessive intercourse will relieve you from the prostatitis and all.
Oh, okay.
Because there is congestion. If the semen does not come out, it will get accumulated inside the prostate, and it got congestions. Because it has got limited capacity. So you are if you are discharging the semen frequently, the incidence of prostatitis is seen less in those persons.
All right. So basically, what are some symptoms associated with BPH, which is, as you said, benign prostatic hyperplasia?
Yeah. See, the prostate sits below the bladder, around the urethra.
Okay.
There is a tube which brings the urine from bladder to exterior. That is known as urethra. And this prostate gland just sits immediately below the bladder, and it encircles the urethra. So as prostate grows bigger in size, it will try to squeeze the urethra. It will try to compress the urethra from outside. So as a result of which, the patient has two types of problem. One is a irritating problem, like a storage problem, other is voiding problem. Means the patient will not be able to pass urine. He has to struggle to pass urine. He will take it more time to pass urine. He has an interrupted stream, like he has to strain too much.
Okay.
And time will come when the patient will not able to pass urine at all. That is not acute urinary retention. And sometimes if neglected, it can cause back pressure over the kidney, which can lead to renal failure also. This is a voiding problem. One group of symptoms is storage problem. Patient is not able to hold the urine. He is not able to store the urine. That is intense frequency. Patient need to start with, the patient has usually in the nighttime frequency. Patient has to get usually less than one time we have to get up in the night. But if we are getting up more than 2-3 times, it means increased frequency. It's not a normal.
Correct.
So it's not nocturia, it's night frequency. Patient to go 5-6 times in the night, 5-6 times in the daytime. He may have urgency. He may leak on the way to the toilet. That's not a precipitancy. So these are the irritating voiding symptoms. And both together in order lower urinary tract symptoms. So these are the common symptoms of the prostate, and usually encounters after 50 years of age when the prostate grows bigger in size.
All right, and precisely this is found only with men.
Yeah, only with the men, because prostate gland we don't find in female. It's a male reproductive accessory organ.
Okay, so basically, doctor, as you have explained me, there are certainly some troublesome symptoms of this BPH, isn't it?
Yeah, correct.
Which are troublesome symptoms?
Yeah, this troublesome symptoms are urgency. The patient, suppose patient is traveling on the way from his working home to working place, and he will have intense urgency to pass urine.
Okay.
But he won't be able to pass an intense frequency each time, because you are sitting on the workstation and then you have to go every half an hour to the toilet. Most troublesome, like urgency, frequency, and sometimes patient leaks urine. Okay. So if it leaks urine in that garment, then it will be a smelling. It's an embarrassing situation for a person.
Yes.
So frequency, urgency, and incontinence, they are most troublesome symptoms which is encountered in the BPH, or for namesake benign prostatic hyperplasia and cancerous prostate. Right. Both have the same symptoms. There are no different symptoms. Symptoms wise, the cancerous growth, non-cancerous, both have same symptoms.
Same symptoms. So basically, do we have any treatments available for BPH?
Yeah, we have a treatment. We have a medical treatment and surgical treatment.
Okay.
For medical treatment, a lot of medicines are there. Which is tried in those patients who does not have very severe symptoms, or those patients who does not have this prostatic enlargement has not affected the kidney. Okay. Like if the patient has a recurrent urinary tract infection, in spite of so many treatment, he's visiting from door to door to the physicians and all, he's not getting relief of the symptom. If he's getting blood in the urine, if he's getting retention of the urine, or kidney is getting damaged.
Okay.
These are the indications where doctor will say, no, sir, you have to go for surgery. We cannot wait for medical treatment.
Okay.
Other way, if the patient mild symptoms, like he hardly has to get up twice and thrice in the day, night, or daytime, but he has a frequency, and he has to struggle to pass urine. In those conditions, he can try medications. So, yeah, medications.
So, doctor, is there anything else, in regards to the clients, or probably what do you call the patients, who will have to be very careful in regards to the BPH? How is that they can avoid these symptoms during their aging process?
No, that's why nowadays we are going to the health screening program.
Okay.
The patients after 60, 65 years, they think that old generation person that okay, this is okay for my age and for my status, but it may not be okay. There may be some hiding problem inside the prostate. So they have to pick. So we have to educate the patient how to pick up the earliest sign. Like you have to train them what is a prostate. There should not be any panicky among the older. The moment we say that you have a tumor, you have a growth, the patient become more panicky.
Yes, certainly.
So we have to cool down them, and we have to educate them what is a prostate. It's nothing to worry. It is a part of aging process. If any symptoms are there at the outset, you can get medical treatment and you will be relieved from all those symptoms.
Superb.
So, yeah.
So, doctor, it was great talking to you on my show on this in regards to the BPH information that we have put across to our lovely listeners and viewers. And is there anything else that you will have to share with us?
Yeah, that's still surgical treatment we will not discuss. There are surgical treatment nowadays.
Yes.
The medicine fails, we can go for the surgical. And nowadays, when in 90s and all, there are open surgery for the prostate where the endoscopic surgery are not available. Now, endoscopic surgery are available everywhere. Okay. Like TURP, transurethral resection of prostate, means we will not put any incision or incision marks on the skin. We will go through the urethra and take out the prostate all around and clear the passage. The obstructing part of the lumen is cleared by electric current.
Okay.
We'll just chip it out all around. So that can be done either normal electric current, which is on a TURP, and other HOLEP, like laser surgery. This is a high-tech surgery nowadays, where the patient has a cardiac problem, patient has a bleeding tendency. In those conditions also, the patient go for laser surgery. Only it will be costly, but patients are very safe in all those hands.
So people who wants to be safe, things gonna be fine with them.
Yeah, correct.
Superb, doctor, and thank you so much for being on my show. And this was Dr. Surya Kant Choubey, the professor and
Thank
HOD
you.
of St. John's Medical Hospital and College. Thank you, sir. Thank you so much.
Thank you, Vicky. Thank you so much.